in kind of like an etch-a-sketch, and I'm painting in exactly where I want to put energy, and conversely I'm taking away areas where I don't want to have energy, okay? And by looking at the different levels through
Before you
here,
turn that, can I ask you a question?
Mm-hmm.
You don't want energy?
Well, that's not going to allow me to put it there yet because of the plane, with the plane we're at. We will fill that in.
You know that from like the subtle
See,
whiteness there?
There it is right there,
Gotcha.
see? There's the plane, I wish we got that. So, you can get a sense that maybe the apex even comes out this far. And now we're going to look at this at different levels. This is very high, looking from the top of the prostate down, and you can start to see where the apex clearly is this region right here. And you'll see that as I'm putting energy, I've got the whole prostate covered here very nicely. In fact, you can see out laterally.
Now now right here, you're posterior to the.
It's the corona plane.
Yeah, right.
Apex, base, and we're taking an image coronally.
I mean, the prostate is like this.
We're coming through here, like so.
Right.
If the plane is through here, right here.
Yeah. Now the apex is here,
Apex,
and then
base
down
is
low.
there.
You know,
But
this is
where the base is better.
Yeah.
Apex, base,
Right.
lateral, apical, or the coronal plane, right through the basically just below the middle of the treatment zone, right through here. So if we look at this, I'm looking at the different images. I want to make sure I've got the prostate covered. Now we can say, okay, maybe that's excessive there, maybe there. But I've confined that treatment pretty accurately to this entire prostate. Okay? I've got the whole prostate covered. And conversely, I don't want to be way outside either, unless you had disease out there you wanted to treat. So if you had bulky disease out here, we can tell the computer to deliver energy outside of that prostate or to hit the capsule, an area outside of the capsule. So by using this, I really can go back. Now I can look at the transverse images, the sequence of images. I'm going to start at the base. The Foley catheter balloon is right here. Seminal vesicles are right here. That's truly the base of the prostate. As I move forward, 3 millimeters. Each step is 3 millimeters as you move from apex to base or base to apex. In the longitudinal plane, that transducer moves in 3 millimeter increments, and there's 15 steps available, or 45 millimeters. So 15 times 3 is 45, moving in and out, apex to base. Okay? So now I'm going to just sequentially follow this, and I want to ask myself, is the prostate totally covered? Now, this is a transverse plane image. There's the Foley, there's the levator ani. The levator ani are in a plane slightly posterior to the plane of the urethra in terms of their anterior-posterior position. To identify the true apex of the prostate in transverse plane imaging, we want to be absolutely sure that the levators are on the same plane as the urethra. So this image anatomically is a millimeter or two just beyond the apex and into the membranous urethra. The significance of that, if we put energy onto the membranous urethra, that's a very high risk of stricture, which, like everything else in urology, that's something to worry about. But here, this is probably going to be just a little aggressive. In fact, if I took these away, now look at the image. Urethra, look at this. Levators, that's truly the apex of the prostate. So when I see that image, I try and keep energy off that spot. Okay, off that spot. If I was to go out here, or see, tighten that up a little bit. We'll see that. We're going to see that sagittal plane. So now finally we want to do the sagittal plane image. And I see way out at the side, I see a little bit of tissue out there, right? So I can put energy to it. You've got to plan this using all 3 dimensions. You can see that confining the prostate, we've got energy targeted very precisely to the prostate.
But it does go outside the prostate. You said the first couple images, right?
Well, you want to make sure you include, you're going to include the area, but on the top, you always put some energy on top of the prostate anteriorly, but there's not a lot of consequence to that.
Okay, so a third of it is...
Yeah, so this looks very, very good.
That's phenomenal.
We've conformed the energy beautifully to the shape of this guy's prostate. We've been very accurate about it. We see it in 3 dimensions. And that is a very good three-dimensional plan. So now we'll just move into the actual treatment.